Blood test for pregnancy confirmation. How does it work? If you and your spouse were planning to start a family and suspect that you are pregnant, chances are that you've already taken a home pregnancy test. If the test says positive, then you must be ecstatic. But the journey has just begun. You will now have to see a doctor to confirm your pregnancy. The doctor will suggest a blood test for the same. The best way to confirm a pregnancy is via a blood test. Blood tests are also done in the early stages of pregnancy to ensure a healthy and happy journey into parenthood. What is a blood pregnancy test? A blood pregnancy test is done to determine whether a woman is carrying a child or not. It is the first step in the journey of parenthood. Several factors are accounted for in a blood pregnancy test. A urine test which can be taken at home, whereas a blood pregnancy test needs to be taken by a specialist in a clinic or a diagnostic center. A blood pregnancy test is taken to know for sure if a woman is pregnant. It is used to test for the levels of HCG or pregnancy hormone in the body, which only elevates if you are pregnant. To take this test, some amount of blood sample is extracted from the woman and then tested for HCG. The hormone human chorionic gonadotropin, HCG, is detected around 8-10 days after conception. Why should you choose a blood test to confirm pregnancy? While it is easy to take a home pregnancy test, which is a urine-based test, it is not always accurate, as the time period from conception to the time of next menstruation is not clear. A blood test gives the exact result and also helps to identify and confirm the pregnancy early. Types of blood test to check pregnancy. There are two types of blood tests used to determine pregnancy. Depending on when it is taken, it could either be a negative blood pregnancy test or a positive blood pregnancy test. The two types of blood pregnancy tests are: 1. Qualitative HCG blood test. This is to know if the pregnancy hormone is being produced in the body or not. 2. Quantitative HCG blood test. This test is done 48 hours apart to determine a specific level of HCG to be measured in the body. How is the test performed? The pregnancy blood test is performed by a technician or nurse who first draws blood from a vein, which is usually located by identifying in the forearm or hand. The blood is collected by using a syringe or vial. The blood test is usually performed at a separate diagnostics lab and then sent to a doctor, or you may have to go collect the reports. The test usually identifies and determines the level of HCG or pregnancy hormone in the blood. How are the test results interpreted? Results from a quantitative HCG test can showcase raising levels of HCG in the first trimester of pregnancy, and then it starts to decline. Some interpretations of the test are: 1. The presence of more than one fetus, that is twins or triplets. 2. If there is a sign of ovarian cancer. 3. Non-cancerous tumors of the uterus. 4. Infection or malignant tumor of the uterus. If the levels of HCG are less than normal, it can also indicate: 1. Possible death of the fetus. 2. An incomplete or complete miscarriage. 3. An ectopic pregnancy. How accurate are pregnancy blood test results? The blood pregnancy tests are 98 to 99% accurate if they are performed around 7 days after ovulation, a week prior to the period being due. Although there are chances of false negative results and false positive results too. Can you perform this test at home? A blood pregnancy test needs to be taken at a gynecologist's clinic or at a diagnostics center and cannot be taken at home. If you have an intuition that you could be pregnant, you can take a home pregnancy test or a urine test initially. But you must get a blood test done to confirm the pregnancy. It is also important to mentally prepare oneself for the journey of parenthood, as it's a big responsibility.